Alcohol Brief Intervention, or ABI as we like to call it, shorten it down, is basically a 5-minute chat that anybody can have with anybody else about their alcohol consumption. And the aim of it is to help that person reduce their drinking from hazardous or harmful levels to move towards being more of a sensible drinker. We're not saying to cut out drinking, we're saying to cut down.
We have a conversation. At the beginning it sounds like just a very casual conversation with the patient, but it's structured and it's about getting them to identify what role alcohol played in their injury. For young people, I've discovered that there's very little mileage in talking about their health because they can't visualise what they're going to be like when they're 50 or 60 years of age. I'll be honest, I use vanity as a tool. If they're attractive, and most people are, I discuss the fact that they've now got a facial injury and it's not going to go away. They're going to end up with a scar, and this time maybe they're lucky, they've got a small cut above their eyebrow. The next time it could be a bottle in the middle of their face and a very serious injury, and all the plastic surgery in the world is not going to rectify that.
I'm mainly targeting trauma and maxillofacial clinics. So it's people who have been brought in, they've got a facial injury, usually in the main, and it's probably as a result of alcohol misuse. So what we do is we screen each patient, they answer a very short questionnaire, 4 questions, and then from that the nurse will then discuss alcohol use with them.
To give you a really good example of how it can be used in a whole range of different settings, we trained one youth worker who was also a rugby coach. And he's told us since that he's used alcohol brief interventions to motivate one of the older teenagers.
During my role with Cardiff Youth Offending Service, I did the alcohol brief interventions training. We had a promising player playing for us who would regularly go out on a Friday night, and his level of performance was at a certain level that I knew he could play a lot better than. We had a chat, somebody he trusted. You could see that his level of performance really increased after I spoke to him, because he stopped going out on a Friday night, and this lad was one of the leaders in the team. So as a result of him not going out on a Friday night, a couple of the other players started to stay in on a Friday, and then the team performance on a Saturday got a lot better really quickly.
We're talking about people who are perhaps straying into the hazardous and harmful levels of drinking, perhaps don't even realise that there's a problem with their alcohol. And what we're doing through, or what Public Health Wales and the Welsh Government are doing through this brief interventions programme, is giving people who come across people who may be having problems with alcohol training in really how to raise the issue, how to broach the issue and get things moving in the right direction.
The message is not don't drink. The message is not to enjoy yourself, not go out and enjoy yourself. Have a drink, but have a drink safely.